is Kieran Barber. I'm the Digital Engagement Officer at FET. My role revolves around the digital transformation of the organisation. That focuses on internal digital channels, as well as working externally with various other organisations to develop digital frameworks. So again, thank you very much for joining. I hope you've enjoyed the series so far. Again, as Summer said, digital transformation may be new to a lot of people. It's certainly fairly developed in terms of across various other sectors, but in terms of global health, it's still an area which there needs a lot of focus on. A lot of this due to the last couple of years in terms of global health. We've seen quite a dramatic growth in virtual channels being developed. This has been especially, I guess, escalated by COVID and climate change, which has resulted in quite a larger number of projects being carried out through virtual channels rather than in-country development itself. So in terms of today's focus, we'll actually look at what digital transformation is. We'll focus on its objectives and barriers. These are extremely key in ensuring that any digital intervention is carried out correctly. We'll follow a couple of principles called the Principles for Digital Development. These principles focus especially on development in low and middle income countries, and to ensure that any type of digital project or product that we carry out is done sustainably and in an effective way. We'll also hear from Judy Jones, who is the project manager of Talent Groups, a collaborative project between the University of Salford, HEE and FET, and how she carried out her digital transformation of these groups themselves. We'll then go on to look at an example of a digital project which FET has carried out, which is called Pulse, an online community platform for the global health community. And again, we'll touch on a couple of those principles and how this could potentially be a channel for support moving forward for anyone trying to carry out any type of digital transformation. I'll then finish up with just a quick Q&A and then any reflections on the content itself. In terms of digital transformation, so digital transformation is simply the process of using technology, digital technology, to either create or modify existing projects, processes, and typically end user experiences as the outcome. These are usually to meet changing environments. Now, we spoke a bit about COVID-19 and climate change. These are probably two of the most recent examples. And again, these have particularly accelerated the use of digital channels instead of in-country volunteering. If anyone attended the first series of Going Global, we heard from Cambridge Global Health Partnerships, who detailed that traditionally the majority of their work and volunteering experiences was in country, and then there was a dramatic shift to adopting new technologies, new ways of working to ensure that we could connect participants in the global north and south in effective collaboration. So in terms of technology itself, everyone, I guess, on this call will have some experience of technology through their use of their job. So transformation is not specifically the change from analog to digital or from in-person to virtual. It's more about how we look at those current processes, I guess, and use technology to improve the outcome of that process itself. So in terms of looking at digital transformation, there are key principles which I've detailed here, which we should always try and follow, trying to follow objectives and overcome the barriers. So one of those projects been improving the delivery of the work itself. So digital transformation should only come into play if it does actually improve the delivery of that work. So we see a lot of examples of people being led by technology. This is traditionally through some sort of collaboration where there's a need, but the failure to really look into what's going on the ground. So the need to improve could take the form of better data, increased collaboration, Diversity of stakeholder engagement. We know technology in some instances can allow us to reach marginalised communities in our work. Improving KPIs, for example, and a fairly popular one is reducing admin time and heavy tasks. So that kind of takes us on to the next part in terms of streamlining tasks. So technology is very helpful for this, especially in recent developments through collaborative tools. An example of this could be Office 365 or Google Suite, Dropbox, Trello, these type of solutions, which we think are, I guess, are standard for us. But when we look at collaboration and working with external organizations, that's not always the case. Digital transformation also includes a future proofing when it comes to streamlining work. So throughout your journey, it's always important to think about potential improvements, what we could do to sustain or build on sustainability in country, but also look at bringing these benefits back to the NHS and the various work that goes on within the UK itself. Sustainability is massively important, so it's probably the greatest impact that digital implementation can have when we come to overseas working. Where we see the biggest barriers and failures is when a short-term project tends to become abandoned and futile, and that technology which is being used can either complicate internal processes, or there's the lack of training, lack of sustainability and support maintenance going forward. So we'll touch on that later on when we look at the principles themselves. In terms of barriers, so local engagement, there's a lot to focus on, and some of the elements that will be coming up within the Going Global series will touch on this when we look at equality, social inclusion, diversity, for example. So there's a few questions that need to be asked. Is the technology widely used and accessible on the ground? No, there's a lot of opinions in terms of which type of process or technology or tool which we could implement, but without that compatibility on the ground and experience, there will always be a failure to adopt this technology. So it's very important, and we'll touch on this later, to look at end user advisory groups and building steering committees built up of end users to really overcome these barriers. Technical experience is also fairly important. So, are the users comfortable with the type of technology which is being used? There is a very high chance, I guess, that you will see, a skill gap with certain technologies which are implemented. This could be anything from online learning material to new collaborative tools, databases, project management systems, etc. So it's important, again, linked to what we mentioned earlier about speaking to those on the ground and getting an idea of the current infrastructure and ecosystem which is going on within their process base itself. There's also a lot about regulations, privacy and security. We always hear a lot about GDPR, but there's also the in-country elements to that. How do their national requirements affect particularly the way we collect data, store and utilise it as well? One of the biggest issues, and we see this quite predominantly in rural areas, is issues over bandwidth or low internet connectivity. We'll touch on that a bit later in more detail through some of the case studies. This is also linked to potential issues with government restrictions. We've seen a number of examples through Myanmar, Uganda, Ethiopia of blacklisting various technology solutions. This is also quite common in certain social media tools such as Facebook. This is very important because a lot of the work that goes on tends to revolve around communities of practice, which Jude will be able to explain later on. And when a lot of those tend to be on Facebook, that can have a massive impact on the work that goes on the ground. So lots to consider moving forward. In terms of a digital divide, we know, in terms of the research that, for example, women are far less likely to own devices than men. This could impact, again, various GESI elements, which will be explained later on in the series. We need to know about the kind of resources and finances available. For example, we have a case study of a volunteer trying to implement and take over Apple devices to rural areas in a low middle income country. And therefore, the impact that has is if there's not the local support and maintenance on the ground, that project will be extremely short term and most commonly fail, as it did in that instance. In terms of sustainability, again, it is a barrier. So in terms of budgeting costs, support, which we've mentioned, especially expertise, once that project has completed, is there the resources available and the, again, expertise to carry on the sustainability moving forward in itself. So moving on, we'll now touch on the principles for digital development. Now, these are a group of principles developed by the Digital Impact Alliance, who are a think tank at the United Nations, and they focus on supporting digital interventions in low and middle income countries. So with the advance of technology, probably around about a decade ago, we saw quite a great benefit to the international community, especially in global health, in terms of developing particularly communities of practice and integrating healthcare solutions on the ground, revolving around patient data. So again, very, very great successes, and we see again, especially being able to link in through to various communities previously marginalised and being able to create these user groups and wider stakeholders, which we mentioned. But also we saw quite a high number of failed implementations. The thing about these failed implementations is that the vast majority of them were predictable and very preventable. So this again is an attempt to try and guide us away from guide us towards overcoming those barriers and ensuring that we remove any chance of failure. So I'll quickly just run through them. Design with the user will actually focus on in a bit more detail because this tends to be the first stage in the process, and the highest chance of getting this correctly is if we can apply the principle here. So designing with the user basically means getting to know the people who you're designing the project implementation with on the ground. Take, for example, setting up a telemedicine solution, the ability to have a virtual appointment with a clinician. By creating that kind of core project team of users on the ground, you can look at various solutions in the country, what's worked, what's went wrong, look at how to overcome previous issues. So by building a diverse range of users from project management to the users to various external stakeholders, you tend to seriously improve the uptake of the system especially. As I said, we'll go into this a bit more detail how we can tackle that. Understanding the current ecosystem, linked often in the same stage as designing with the user. So again, looking at what is already out there and user capability actually on the ground is very important. So say we're looking at implementing an online training module, which again is a very common theme just now in terms of online training. There's a very high chance that this has been attempted in the past and failed to take off. So 9 times out of 10, this results in lower adoption rates if this is tried again. So there's the need to kind of look at what went wrong, what could be changed. We have numerous examples of, again, linking back to rural users. Online learning platforms tend to use a lot of data because they tend to be quite complicated, and therefore they don't have the bandwidth or support to access the system. So then there's the look at needing to change the content, text-based, to use as much internet as possible. Is there possible centres that we could use and allocate to be able to understand it? And these are some various circumstances we've dealt with in the past. Designing for scale is all about looking forward as well as to sustainability. So say we're looking at implementing some type of database at an institution in a low middle income country. So you might look at, typically what we would do, look at, for example, Microsoft Office, which we know and we're used to. Perhaps that's not either accessible or outside of the budget. It takes a lot of training to actually utilize this system to to its full content. So perhaps we don't have the resources to carry that out. Maybe we need to look at other systems, such as a system like Airtable, where we have an online presence. It has that support from the vendor or the provider itself, and a lot more sustainable. What we need to think about is these type of solutions, and a lot of solutions tend to charge by the usage, where that could be the number of users or the amount of data you use. So it's quite important to look at kind of future trends, the potential growth or future budgeting of the project, consider perhaps how that could impact going forward. It's also important, therefore, to look at how that would integrate with current systems on the ground. Health workers are required to capture patient data. So will this, I guess, add further burden to those health workers themselves? Is there a way that we could scale this together with what's on the ground, capture actually lots more data and a higher quality of data, which would improve the project itself? Sustainability, very, very similar. So in terms of maybe looking at when the project is finished, you know, do the staff have the capacity, to carry on after its completion? So it's important to kind of build quite clear and succinct training material, but again, something that's not overburdening on the users. What's quite a good tip, which we see quite often, is to create community forums between the users themselves. So we start to build kind of bi-directional learning, which comes at a much higher standard. Is something we see quite often. Data is kind of the key phrase, and then a lot of the projects we look at, so I won't spend too much time on it, but it's quite important to consider this at a very early stage. If you're implementing a solution, it's important to get the structure correctly in terms of which data you need to collect. It can sometimes be very difficult to change this as time goes on. And again, how many nurses have been trained in this period, gender diversity, age, etc., is all, you know, important data, which again will be covered later on. Open standards, again, kind of similar to communities. You're quite often going to see probably and find the best advice off of other partners who've been involved in various projects, but again, important not to be led by the technology and make sure that it actually does meet the requirements. The project in hand, which Judy will focus on in terms of the talent groups, we had a quite detailed comparison of different solutions which covered various areas about accessibility, usage, sustainability, etc., which again would probably not have happened unless we actually looked at each solution and each digital tool themselves, rather than just going off perhaps what was suggested. Privacy is extremely important, as we all know. So whether this is looking at cybersecurity, information management, very important. One key trend which we see quite often in global health is that, for example, in the UK and the global north, we have quite a high usage of cloud computing, which is the storage of our data in the cloud and not on our device. Whereas in the global south and low and middle income countries, there's quite a low uptake. Now, that's not too much of an issue if the data on your local devices is stored securely. But when it comes to issues, is we have two different sets of data, very similar data in two different areas. That can cause major issues when it comes to compliance, security especially, and heavily on admin time. You often see the need to compile and create numerous forms of the same data and the same type of content, and it often tends to be lost within, in between the two sections. Collaboration is very important. So that's an example of what we'll look at later in the Pulse platform we've developed, but again, linking with designing with the user internally and sharing your experiences externally is how we manage to build these communities of practice. And again, increased learning will only encourage increased usage of the digital implementation itself. So we'll share some further details about the Digital Impact Alliance. There's a lot of work that goes on and a lot of case studies which are extremely useful for any projects which you may be participating in, but we'll reach on that a bit later. In terms of taking that first example, we've created a bit of a procedure which is quite helpful, and we'll tie in some practical examples when it comes to that early stage of a project. Looking at the first, analysis stage, forming a user advisory group. So an example, creating a technical communications plan. Do we use email for audit trails? Do we use Telegram, which is a WhatsApp alternative for informal messaging, which tends to be the trend in a lot of low middle income countries? Do we use, for example, Zoom for various meetings? So this is kind of linked to help finding out about which solutions are commonly used on the ground. It's really important, again, not to make those assumptions. In terms of identifying the needs and requirements, so at this stage, we want to actually remove technology from the equation altogether and actually look at what the real issue is in hand. The question should then lead to how and if technology can help. So again, important not to be led by the technology. We see instances of, again, projects being led by suggested technology from another colleague. Again, great, but it may not be applicable in your instance. So yeah, does your organisation have the internet bandwidth to support the tools with potentially a heavy demand on the system? There is quite a lot of outdated and older technology being used, and the technology we used is racing far ahead, and that gap in there causes quite a lot of issues. Important again to know with the solutions that we're using, if they're not being used, do you have the time to actually carry out efficient training with the participants? So whether you're using an internal system or looking at across external methods, it's always important to include almost a user base of who will be using the system at this stage, to pick up, for example, of any red flags. There's an example of, again, a telemedicine case where went ahead right to the end stage to almost purchase of product, and then only when we had the clinicians involved did the partner find out that in fact this had been trialed before, but culturally on the ground the users didn't trust the system because they weren't aware of what that website was, and their easy alternative was actually to go and use Telegram. So again, that was the impact of not actually having the user body involved from an early stage. With designing development, so again, it's in terms of ensuring kind of a diverse testing, we do need a diverse team of stakeholders. Now, this ranges across the individual themselves, but also technology. So looking at where they're located and ensuring that we're not widening the digital divide, and we're not excluding anyone from accessibility to the system. An example of this, quite a common example, is in rural areas, certain health information systems have been deployed for members of the public, but with low literacy rates. So, for example, there's the inclusion of voice-activated text to help get around these barriers and these linguistic issues. And that's, again, quite a common theme, which we'll share some case studies about coming up. In terms of deployment and rollout, it's quite important not to overburden the users with a lot at once. So we consider starting off with simpler changes and then actually moving in with developing the project. That has two benefits. One is you will improve usage of the system, but also gain that feedback from the users in terms of what you need to change to suit their requirements themselves. And again, that continued learning should carry on throughout the process, not just through the project kind of review stage. The same with technical champions. So these user advisory groups, we need to create some type of steering committee to ensure that they're collecting the feedback and that we can look into internally on the ground how we can promote and develop the situation, the solution, how we can adapt that to other situations. In terms of monitoring and evaluation, so again, that's that kind of continued review. We often build kind of log frames, actually quite simple test feedback documents on Word, just with the name, the issue. On the Pulse platform, we received around 300 lines of feedback in terms of changes and feedback from the platform, which we developed. And again, this was done over the Global South as well. So again, trying to simplify and not use complicated solutions for those on the ground just encourages uptake. Again, with analytics, this is where technology is extremely helpful with reporting back in the project. So most solutions now have quite detailed analytics on the back end of the various platforms and solutions, which can be compared, analysed and modified to suit. And again, that links back to making sure have those processes in hand at the start. Sharing data again is important both with the users themselves, again linking back to the feedback, and then externally with the communities to ensure that we can adopt various technologies to improve. In terms of some scenarios, so again, launching a community of practice is probably quite the common theme here. So is the platform accessible or used in the region? It's easy to try and find and implement kind of methods of communities of practice, which we're used to. Tends to be through Facebook or LinkedIn, maybe, as we've mentioned. However, often tools such as we've mentioned, WhatsApp, Microsoft, Apple products are not used either at all or even accessible within the region. In terms of looking at the appropriate questions, so look at the data you wish to collect on the community, how often they access the site, popular areas, least popular areas. These will give you the feedback as to where you can change and adapt various tools to continue meeting the user needs. Again, looking at the in-country data protection regulations, how does this impact GDPR and even our own understanding of data protection? It's extremely important that when you are sharing data, it's for a viable reason and you carry out specific regulatory methods, which we'll be able to share more details on how to ensure that you're not putting any of the users in danger. Digital safeguarding is quite a hot topic at the moment. It was predominantly applied to children accessing technology, but now that is now being branched out to marginalised communities within the country. So there'll be a bit more shared on that after the webinar. Implementing a learning management system is again a very popular method at the moment. Again, a lot of VET's work and the partnerships that work with VET involve some type of learning of health workers. So there's now a look at the benefit to health workers of creating modulars and online courses. But this is where we kind of start to run into quite a lot of issues. So internet access, for example, if you're looking to conduct the training, will everyone be able to join? So that's about the content. If you're looking at hosting live sessions, something like Zoom here, although it takes up pretty low internet for us, is completely not the case in the global south. Even the case of recording it and placing it on platforms, it does reduce the burden, but we still see a lot of issues. So there's a lot about accessibility and who can access. For example, NHS 111 is a very good example of our online site where we have very accessible data which uses extremely low internet and low bandwidth issues. Again, one example is where we're launching a platform in Myanmar, and the benefit is that the content can be accessed offline when the user has an internet connection. If it may be sporadic, the platform syncs in the background, updates the data, and then when they are out of internet connectivity, they can still access that content in, for example, an emergency situation. So all quite important aspects to note, especially again when it comes to the safeguarding. Again, important to look at the technical skills. Online learning platforms are very complicated and can be extremely confusing for a number of users. Should there be this? It depends really on the requirements, in terms of maybe the data you need to collect, but could it simply just be, an online page with resources? Do you really need them to go through these online modules? Which again, you tend to see across the analytics, the drop off throughout the course quite often. In terms of, again, does this clash or integrate with current learning tools? Will this complicate issues for either the health worker or the end user on the ground? Again, this is more along the lines of content, which again will be detailed later on. But yeah, it's really important from a technical point of view, linking back to that, understanding what's going on the ground to make sure that it's either in line or it can be, you can benefit what's on the ground, especially. A lot of the time there is almost an attitude that we can come over and replace what's going on, but sometimes there's just a need to provide a bit more support to build on what's going on the ground, as I said. Actually, in country itself, this is where we look at quite a number of issues. So in terms of both kind of system-wide and individual access, we know from kind of policy and regulation that there's partial internet blockages such as Facebook and Google, actually for a period in, for example, Vietnam and permanently in China. So is it then reliable and sustainable? Very important to kind of know where your data is held also. Data should be held within servers which at least are GDPR compliant. And now a lot of systems you can request for that data to actually be transferred to systems in the UK. It may sound kind of complicated processes, but it is important again for the safeguarding of the users. What we're actually seeing, for example, in Myanmar and other countries is targeted blockage of platforms which are based in certain countries, for example. So websites or platforms where they host their data in certain countries becomes inaccessible. So there's the need to ensure that, again, you look at what's going on the ground and the expertise that's going on. There's various NGOs and organisations who support this type of training, which we'll be able to provide more details on. In terms of, I guess, usage in the country of device, prepaid popularity. So prepaid mobile devices are extremely common within the Global South. However, this has a number of different issues specifically around bandwidth. They tend to come with a lower amount of data and they actually use a higher amount of data than standard. So if they do rely on mobile internet, it's important to know that, again, will be covered in kind of content elements, but large file size such as video, high resolution images can be extremely hard for LMIC users to access. Again, we know that women are much less likely to own mobile phones. So again, linking back to looking at your data at the start, we can collect that data to help, I guess, highlight the equality, diversity issues within the programme. We ourselves collect data on gender, location, disability, regional access, plus 100 other indicators, which allow us to actually analyse our system. You know, do we have too much of a high global south, global north presence in terms of collaboration and bi-directional learning, which are the key outcomes. So these are actually reviewed on a monthly process. We look at analysing the movement of these trends, increase in users, decrease in certain areas, to allow us to continuously develop certain platforms. So what we'll now go to, we'll hand over to Jude. Now, as mentioned, Jude is the project manager of the Talent Groups, a project run by University of Salford, FET and Health Education England, I should say. She'll talk us through a bit more about the groups and how she handled her digital transformation, and then I'll maybe touch on how they sometimes interfere with some of those principles themselves. So delighted to introduce Jude Jones, and Jude, I'll hand over to you now.
Thanks so much, Kieran. Right, let me share my screen with you all. Just bear with me a second. So hopefully you've now got my presentation. So yes, as Kieran said, I am Jude Jones and I am project manager of Talent Groups. I'm also a midwife, and I also am lead midwife for Face Mum's future midwife pilot as well at the University of Salford. So what is Talent Groups? First of all, Talent Groups is an acronym, and it stands for Technically Assisted Learning and Education for Nursing and Midwifery Teams. As Kieran was saying, it's a collaborative project, and it's Health Education England funded, hosted by the University of Salford, with Nursing Now Challenge and the Tropical Health Education Trust. And our team are made up of people who have worked on previous online communities of practice projects, and obviously as well the Health Education England expertise as well is really important to us. So the context to which Talent Groups was created is obviously, as I'm sure you're all very aware, the wealth of evidence about the need for developing and improving midwifery and nurse leadership to drive forward healthcare globally. And, you know, globally, there's not one country that doesn't need more nurse and midwife leaders. So Talent Groups was created as a tool to host leadership development in that context. Sorry, my children are coming home, so the dog is now barking, bear with me. So there's also a digital context to where Talent Group was born, and born being the operative word really. We come as well from a project called Face Mums, which was run in the UK, excuse me, and it was piloted in 2015 in 2 large northwest of England hospitals. In essence, Face Mums is a group of up to 20 pregnant women who've just been booked at their NHS hospital. And in that group with them on Facebook are 2 NHS midwives who also are at that hospital, who work for that trust. And in this pilot, there was findings beyond expectation. I mean, the original ethos for Face Mums was that it was trying to create a place for people to meet where they already were, rather than trying to get people to come into hospitals and venues that maybe they felt a bit exposed and not very used to. We were looking at a project where we went where the people already were. So we knew that women in the UK used Facebook, so that's where we started the project. The findings beyond what was expected around sort of increased information provision and so on, for the first time demonstrated that we could create an online communities of practice that was not only effective for the women within those groups, but also the healthcare professionals. And that was a really unique finding that we discovered. So Health Education England then funded a much larger rollout in 2018. And we worked with 12 different NHS trusts. I trained over 80 midwives throughout those trusts, and 541 pregnant women through a 2-year time frame received additional maternity care from Face Mums. So it's key to note that going back to the sort of digital principles that Kieran was talking about, this was not created to replace anything already existing. This was created as an extra tool to add and enhance care that was already happening. So for these 541 pregnant women, they had this additional tool, and coincidentally, COVID happened during it all. So we also gathered a lot of evidence around, obviously, the benefit of using this digital platform to help people during COVID. So the evidence from Face Mums was, again, very, very positive, with the only people who ever left any of the groups were women who sadly lost babies. It was, you know, it was a completely voluntary initiative, but everybody stayed in the groups. And we also discovered that the groups became self-sustaining. So once the midwives left after their time frame, the groups have continued, and that was a really important finding for us. So we then started to look at how could we take this model and use it in other contexts. So with Nursing Now, we looked at starting to develop the model to look at leadership development. And going with where we knew already, which was Facebook, I created 4 different groups. We had 2 in Uganda, 1 in the UK and 1 in India. And using the same Face Mums model, there was up to 20 early career nurses and midwives with coordinators who were from the countries that we were located, and they were discussing leadership development. There was a lot of learning from this, and that really helped build the plan for talent groups and our decisions going forward from there. Just a quick refresher on community of practice for those of you who may not be aware, but just it is a theory that came from Levan Wenger in 1991. And in short, all of us are in communities of practice in all of our lives somewhere. The community is the people who care about something. So in the context of talent, each community are the early career nurses and midwives within that group with their coordinators. They're all the community. The domain is what we care about in that community. And obviously, again, in the talent context, this is leadership development. The practice is what we're doing together about this. So for the talent context, again, it's looking at exploring nurse and midwifery leadership. Within the theory, I like to think of things in circles with communities of practice, because it is a circle which encompasses everybody in the community. It's not looking at leaders and participants, it becomes a whole community. But within that, Levan Wenger has categorized how people work within those communities. And it's really important, I think, looking at things in a digital context of how the community of practice works. So you've got the core, who are the experts, the people who maybe originally started the groups, excuse me, but become the most active users. And we found doing online communities of practice that flows and changes. So it can start being the people who lead the group, but actually as the group grows and develops and changes, that can become the majority of the people, can become the core. And then obviously you move through active, occasional and the peripheral. And in our social media and online groups, we see this as sort of lurkers. So there may be the people who are in a group and read a lot of things, but don't always comment. And interestingly, from our research around communities of practice online, it doesn't mean that people who are lurkers and who are just sitting and watching aren't getting as much from the group as the people who are very active communicators. We're all gaining something from that experience. So going back to talent and how this all pulls together, what we were looking to achieve was to create online communities of practice that would provide an accessible and flexible environment to support leadership development. Again, going back to the sort of digital principles, it's recognizing that for many of us, in the context of trying to learn something new or develop new skills like leadership development, going to a classroom situation or sitting through a course is sometimes quite a challenging prospect, because we don't have time in our busy lives, and there's different challenges that we all have. So we wanted to create it in a space where people are, and that it made it flexible and achievable for them to do. So the idea is that the talent groups all run for a year, where they have support from coordinators, and that it grows from the seed into a larger growth of the individuals in that group becoming a self-sustaining community of practice. Now, once we'd almost decided what we wanted to do, we had to go through a lot of the process that Kieran's just really expertly gone through about where was the best place to do this, where is the best online platform for us. I think we were very clear from our experience and our evidence already that Facebook was not that venue. We were very clear from the pilot I'd done in 2019 that although there was validity in running these groups, that was not the online platform that worked best for the users. And we really did take the user experience into account when we identified the correct platform for us. And what myself and my colleague Laura did was we looked at this criteria and made a very large document going through all the main social media and online platforms used in the UK, Africa and Asia to try and identify the most suitable platform. And I think it's easy, you can see from the criteria to identify there is no one platform that covered everything that we were looking for, and we really had to explore different uses. We did a lot of research around internet blackouts and how people were going to use bandwidth, but really the most straightforward thing that we were looking for was simplicity. We wanted somewhere where the users were going to be able to engage and not be put off by having to work through a complicated online platform. We needed it to be simple. So we worked through all of these different parts of our checklist, and the result of this was that we identified THET's Pulse platform as the most appropriate venue for talent groups. So obviously Kieran's going to explain a lot about Pulse with you shortly, but how we work within Pulse is that talent groups are this collaborative project. So it's looking at leadership development, and in order to do that, we're aiming to create 20 online communities of practice within Pulse. And each of those online communities of practice contain 20 early career nurses and midwives. And when I say early career, by the way, I mean up to 5 years qualified. And each of those groups has 3 coordinators who are also from that country. So for example, at the moment, we've got Zambian talent group, we've got the Ethiopian talent group, and we've got a Nepalese talent group. And they are existing on the Pulse platform in a group that nobody else on the platform can see. It's there in its, existing within that platform, with the 3 coordinators who are nurses and midwives, leaders from either the clinical or the academic field. And then beyond that, there is another group, which is where all the coordinators are. And this is a really interesting group because it offers a real cross-pollination of ideas. So all the coordinators can discuss how their groups are exploring different themes around leadership and what's working for them. And they can explore how each country looks at that field and then share it across. So Pulse really enabled us to have that space where we could talk about different ideas in groups, but then underpinning all of that, all of our users then have access to Pulse. So they're able to look at wider global health issues. They're able to access other users and other groups, and then bring that back into the talent groups. And that's really, really important to us. We're very clear that this is, although my expertise might be around creating online communities of practice, I'm not an expert in health in Zambia, and that's the people who are in that group are the experts, and then they can then discuss ideas with a Myanmar group, or they're able to talk and share their expertise on the platform that we're just providing. So this is what the Pulse platform looks like for our users when they're there. They're able to access not only their group, but the rest of the platform and find out the different challenges that other people in their professions are experiencing in different countries, and the good practice and things that have worked. It's been really interesting for them. So in summary then, what Talent Groups is aiming to do is to create self-sustaining online communities of practice to promote leadership development globally. And I think why it's worked particularly well, or we're seeing it starting to work very well within Pulse, is that it offers that opportunity for growth and for sustainability. It's a platform that enables us to keep growing, and if we get beyond the 20 groups, then there is capacity for us to keep growing and sharing that model that works. It gives us opportunities for the members beyond talent groups, and again, I think that's really key with digital transformation. It shouldn't be just about the project you're doing, it's how can that inform other projects, and how can you collaborate with other people doing similar activities and share good practice. So yes, that's from me, if that's okay, Kieran.
Fantastic, thanks very much, Jude. Yeah, a great example of, I guess, an internal project that we've carried out recently at FET. And in terms of looking through that process, I mean, it ties in with a lot of the principles. So, you know, looking at those systems, looking at the various requirements, that's, you know, designing with the user, understanding the ecosystem, looking at, you know, the third principle, design for scale. There's the ability to start off with the pilot groups, and then if potential, we can expand those groups to other countries and different themes. Being data driven, so what we can do is each month we can export the data on the community of practice. We can look at how many times, for example, the user has signed in. We actually have what's called an engagement scoring, where we provide points for various activities on the platform, so we can see actually where they're engaging more and how often they're engaging. And then, as Jude kind of mentioned, you know, reusing and improving. Being a member of that group also grants you access to the wider Pulse platform, where again they can look at the other type of projects that are going on, perhaps similar or different to the talent groups, look at what else is going on in the sector. And that's obviously a benefit to FET, as well as advocating for you know, an increase in global health. Again, collaboration is kind of the aim of the game with the group, so that covers that one off. So yeah, a kind of a good example of how we have tackled perhaps the current system, where we need to improve, change, and the ability to adapt and develop as time goes by. I guess that takes us quite nicely onto just a quick explanation of the talent of Pulse itself, I should say. So if that's coming up okay. What Jude's actually described about the talent groups is kind of what Pulse is generally. Pulse, over the past few months, a core kind of project team was at FET was put together to create a new collaborative online platform for members of the health partnership community, or the global health community at large. So we received a lot of feedback from those involved in global health to explain that, look, there's plenty of websites out there with resources and white papers and everything to explain what global health is, but you know, due to COVID and the lack of kind of in-person collaboration, there's no online community really which allows kind of on the ground bi-directional learning. And the key thing is it's across a number of stakeholders. So, you know, I said we've got 500 active users, really only after a couple of months, which range from arm's length body of the NHS, various NGOs, various departments of the UK and foreign governments, health workers, and then, as kind of Jude has mentioned, end users and patients on the ground. So you actually have that idea of bi-directional learning and you know, across the various range of stakeholders. Within the platform, you know, as I said, there's Jude has got one of around 20 kind of thematic working groups now. These range from potential projects, but they're also around various themes. You know, we have a group on the UK response to the coup in Myanmar. We have a group for the Kenyan UK Health Alliance and various other diasporas. We have groups which are focused on building connections and forming new health partnerships, which are specifically developed. And the benefit is that we can actually customize each of the groups in various ways to suit the aims of that platform. But then again, you know, the users have the ability to explore the general platform, where we have a wealth of resources and links. Again, we have over 200 organisations and health partnerships represented. if anyone actually has their camera on their mobile, they can take a quick picture of the QR code and they'll be able to go straight to the platform, or Summer has shared the link in the chat box. So we do hope everyone can sign up. Again, Pulse is an example of us running through those principles, but when we look at one of those principles, collaboration, this is the real purpose, and it turns from being a process to the actual output in this instance. So yep, please do join, and again, like we've mentioned across the principles, keen to hear any feedback for future development. We will soon be launching a mobile app version of the platform. Linking back to the principles, the reason behind that was laptop and desktop usage in low and middle income countries is really low. Predominantly the user has skipped that process and went straight to mobile devices, and that development of the mobile app was really to ensure that we're engaging with certain communities across the globe, and to ensure they can access it. And again, we're not bridging that digital divide. So again, that was a conscious decision. We're also launching a kind of mentoring tool, which, similar to what Jude's is doing, we are hoping to partner those experienced in global health and those being interested, and for various other reasons, again, through that idea of collaboration, to build the collaboration of this digital tool, which we can report back on and provide various statistics and analytics on. So yeah, please do join. And again, that's kind of the summary of what we've looked at in digital transformation. So what we actually have the expertise in, as we know this is quite again a bit academic and research based, we actually do have the experience and the ability to support in kind of one-on-one digital projects. So if you do have any questions or looking at any projects which involve any type of digital transformation, we are there to support, and more than happy to be involved in looking at help plan and assess those strategies. So we have Pulse for the online community, but if there are any comments or support which we can provide, please do get in touch, and I'll place my email in the chat box after the call. So thank you very much. I do appreciate your time today. Please hear any feedback. If there's any questions, more than happy to run through. Yeah, thank you very much.